Mr. Shaw, I'm a native Texan. I'm a nurse by education. Last year, Parkland Hospital had $1 billion of uncompensated care. Children's Hospital had about a third of that. Many of the conditions are respiratory related, which are also related to environmental contamination. Have you factored in the cost that it would take the state to continue to afford this kind of health care cost, with most of our people being poor, that are living in low-income areas that are damaged more frequently by these heavy environmental violations?
Congresswoman, the Clean Power Plan is directed at reducing greenhouse gases, which
Right.
do not impact the respiratory issues. The co-benefits that are claimed in the rule.
Wait a minute, repeat what you just said.
The co-benefits, in other words, the rule is based on reducing the greenhouse
I know what
gas.
the rule says, but you said it does not impact respiratory?
That's correct. Greenhouse gas emissions do not have an adverse impact on respiratory health. High CO2 levels do not cause respiratory issues. I know it's easy to make that conclusion because some of the rhetoric from EPA sort of suggests that the Clean Power Plan is going to, by reducing greenhouse gases, lead to improvement in respiratory conditions. That's not due to reductions of CO2.
What does it do to?
It's due to their co-benefits. They're suggesting that the process that they're mandating to reduce greenhouse gases will also, accidentally, if you will, or at the same time, likely cause reduction in other emissions that they do perceive to cause respiratory impacts. The challenge with that, though, is that they're actually assuming that it's going to provide health benefits, even though your area is already in attainment for the PM 2.5 standard, yet they're assuming that reducing PM 2.5 even lower leads to health benefits, even though their standards say that Houston area is already meeting the standard, and therefore we're not having adverse health effects associated with PM 2.5. That's my concern, is that it's misleading whenever they've told us that you're going to have these health benefits associated with this rule. Most of those are unsubstantiated. The areas where there could be a benefit to those, or those areas that are non-attainment for ozone or something along those lines, those are being addressed through other rules, and we're making strides to comply with those regulations. So CO2 does not lead to respiratory challenges.
So you're challenging the goal of EPA. Their goal is health and safety of the people that inhabit.
Right. The purpose of this, yes, ma'am. The purpose of this rule is to reduce greenhouse gas emissions, and as part of that, the stated goal there is primarily the benefits they claim are a slight decrease in sea level rise, unmeasurable, as well as 1/100 of a degree Fahrenheit reduction in increase in global temperature. Those are unmeasurable, and those are not quantifiable from the benefit standpoint. Therefore, they went to the accidental co-benefits associated with it, not what the purpose of the rule was, to claim benefits to the rule.
So you're saying that it has absolutely nothing to do with the health status, that the science that has indicated that is not pure science?
I'm suggesting that the goal and the objective of the Clean Power Plan and what led to this rule is climate change, climate variability, and that the contaminant that they're specifically seeking in this, the greenhouse gases, and more particular carbon dioxide, which is the focus of the rule, does not have health impacts. Carbon dioxide at the levels that we breathe it is actually good for plants. We breathe in oxygen and exhale carbon dioxide. You have to get much higher levels of carbon dioxide than we're ever going to see in the ambient air to get health effects associated with CO2 to the human health. So the goal of the plan is to address climate change, and yet that impact based on the models.
So climate change has no impact on health.
The model suggestions of what this rule would accomplish would be an unmeasurable decrease in sea level and 1/100 of a degree Fahrenheit in temperature change. So even the best estimate of what the climate change impact and benefit of this rule is so small as to be unquantifiable.
So would we continue to see climate change with a lot of flooding, a lot of air contamination? This is not going to impact health.
And for one, the IPCC, the Intergovernmental Panel on Climate Change, has indicated that the adverse weather that we're seeing has not been correlated with climate change. So there's certainly a science argument to be made and some additional data to be there, but it's not clear that the global climate change is going to have those impacts, and it's certainly clear that this rule would not have a measurable impact on any of those measurable change in climate change.
Could you submit to me your research findings and the origin of them?
Sure, I will be happy to provide you some of the background information on that.
Thank you very much.
Thank you, Congresswoman.
Thank you.